from the patient. No, that's why it's called subjective. Okay, patient data ni siya. So actually, you can just a tip lang, no, and from my own practice man, no, during shift complaint, you may use siguro like quote and quote ka, no, kung amugin na ang exact words na ihambal sa patient. Pero of course, you can rephrase that and you will learn that, no, during Miss Emery's turn na for discussing subjective. Okay, and then we have already provided you, no, with a table, no, for checking general health status na here. Okay, and then other again na parts of the subjective, no, lifestyle, no, family health history, medical surgical history, medications, no, and this one, no, there are some sections here na you can make use, no, if you have patient na or specialized ka na you have a specialized patient, let's say pediatric patient, no, so you have a section here na pwede mo siya ibutang, no, sa iyong mga documentation kung pediatric ka nga, kung may pediatric patient ka. Other clinical tests that you seem relevant, no, na pwede mo na siya. And of course, patient's goal. Okay, so patient's goal, you can quote and quote it there, no, and you can provide a translation man, no, at the next, no. Okay, or kung ano ang masuggest ni Miss Emery during the patient's goal, then you follow that one. Okay, and of course, we have the objective na part. So objective, very comprehensive na siya nga objective assessment, no? Very comprehensive, medyo damo, no? So we have your ocular inspection, palpation, and review of systems. Okay, you can find this one, no, ang parts of the O sa Kettenbach na book. Okay, so may mga dara na no, kung ano ang kinahanglan mo pangitaon on the integumentary system, no, musculoskeletal systems, what are the data that needs to be encoded there. Okay, if you have a burn patient, then you make use of your integumentary assessment, no, ano mga relevant na data dira. Neurological assessment, okay, also nan. Okay, so this is only going through lang, no, of the IE para may idea ka mo. Okay, and of course, we always write the significance, no, kung ano ang findings, overall findings ninyo, no, on the objective assessment. Okay. Diba, nan, ano siya ka-comprehensive ang documentation, no, of a physical therapist. Okay. May mga different structural tests, gait analysis, and of course, no, very important din is yung mga basic ADLs, no, recreational assessment. This is only not limited lang sa amuni na hindi lang siya like amo lang gini ang i-follow ninyo, no. You can make use of other outcome measures, diba? You already know yung mga outcome measures ka mo nga gina-appraise during your EDP. So you can make use of those, no. For example, your functional independence measure or your FIM. Okay. And then, very important na part of the SOAP note is the assessment. So this is where the physical therapist is really practicing his or her clinical reasoning. No, so di mabutang ang applying your ICF, no, some of its components there, no, and the reason behind, no, why amo na siya ang naging findings mo sa imo patient. Okay, from the data you have during your subjective and objective assessment. So you write down your PT diagnosis, no, which is different from a medical diagnosis, kay diba? The medical diagnosis, ara to siya sa may demographic information. The PT diagnosis is solely from the physical therapist, no? Out of the data that you have gathered during your subjective and objective assessment. Your PT impression, prognosis, and then this is where you list all of the problems, no, problem list ni siya, no, of the patient, your long-term goal and your short-term goal. Okay, and then of course we have your PT plan. Okay, and this is also where we suggest home exercise programs, no, where we write down our patient education, okay, and some of the precautions, BP or kung may orthostatic hypotension ang patient or sensory precautions. So we take note of that. And other recommendations, if applicable, if you think they are within the patients that is beyond na the scope of PT. So that's it. And of course, you also need to write there your name. Okay, your name, kailang signature mo na da, and then let's say ako, I'm Gay Marie Ledesma, let's say I'm an intern, no? So, PT, intern. So, always put down your, designation. Pero, what we do before is, UI VMB 2014. Sa dalom niya, we write down SEUI VMB 2014. So, this is our batch name. Pero, I'm not sure kung may batch name na kamo. So, but this is how we write it. No, so you need to have your signature, your first and your legal name, no, and then your designation, and just an addition lang, no, of course, para kung kitis yung intern, balaan kung din kahalin bala na school, and your batch name. Okay. So I will be sharing this with you, man, ha? Okay. So okay pa ka mo? You want? Let's have a 5-minute break. Okay, so 4 minutes lang. I'll see you 8:40 before we start with the discussion. Okay?